Welcome to The Reasons We Smile with Dr. Kvitko, the show that brings you man-on-the-street interviews, celebrity guests, groundbreaking research, and heartwarming stories about the reasons we smile. Our show is also known as everything you've always wanted to know about dentistry, but we're too numb to ask. Hello, I'm General Dentist Dr. Kvitko, and thank you for joining me today.
The following views and opinions do not necessarily reflect those of this station, its staff, management, or parent company. To hear a replay of this show or one of the great shows that previously aired, log on to thereasonswesmile.com or iTunes, keyword Dr. Kvitko or The Reasons We Smile. Listeners should not use Dr. Kvitko's comments and advice in place of an actual dental exam.
Brighten your life with a smile that shows the professional touch of Dr. Kvitko.
Time now for The Reasons We Smile with Dr. Kvitko. Call 459-9769 to discuss your dental issues. Now, here's your host, Dr. Kvitko.
Hello, everyone. Welcome to The Reasons We Smile with Dr. Kvitko. I'm Dr. Kvitko, and this is episode number 447. Thank you so much for joining me. I really appreciate it. I think it's going to be a great show today. Today's show is entitled Doom, Gloom, and a Little Bit of Fun. Okay? You'll find out more about that in a little bit. Hey, before we get on with the show, let me remind you, if you would like to follow me on Twitter, it's at Dr. Kvitko. And I would love it if you would go to my office Facebook page and like us, which is Dr. Kvitko and Associates. Now, I want to remind you that we stream live on ustreamtv.com as well as on thereasonswesmile.com. So every episode we've ever done is available at www.thereasonswesmile.com. Okay, so as I mentioned, today's show is called Doom, Gloom, and a Little Bit of Fun. And what it is we're going to bring you the 7 most painful dental conditions ever and how they will kill you. I'm sorry. I know. Shouldn't be laughing because you know what? A lot of these conditions are pretty painful and dangerous, and they actually can kill you, and you'll be hearing more about that in a little bit. But before we get on to the doom and gloom, I guess I'll change up the order. Let me just talk a little bit about some of the fun stuff. And so, for example, here are some fun facts. And by the way, I found this in a thing called Smile Discoveries from Delta Dental of Minnesota. And it seems that children have the right idea about smiling. Children smile 400 times a day on average. Women smile about 62 times a day compared to men who smile only 8 times a day on average. Now, you know, I smile all the time, so either that makes me a child or it makes me more like a woman than a man. I don't know, but I always smile. I mean, I'm just always smiling. I think it's the best way to break the ice. I think it's the best way to have somebody respond positively to you. You know, if you have a scowl on your face, you typically don't look very inviting. In fact, you look like standoffish. So, but anyway, this is just a fact that somebody figured out. And so I'm going to use it for Dr. Kvitko's question of the day later. So remember this. I'll tell you again. Children smile about 400 times a day. Women about 62. And that compares to men who smile only 8 times a day on average. Pretty interesting. Okay, now here's another interesting another interesting fact. Each person's set of teeth is unique, much like your fingerprints. Even identical twins do not have exactly the same set of teeth. And did you know that your tongue print is also unique? That's pretty interesting. I actually didn't know that till I just read it the other day, but it's pretty cool. Now, I guess we don't go around like doing tongue impressions or tongue prints, but I guess we could. Here's another one. Did you ever wonder if the hand you write with affects your teeth? It can. Right-handed people tend to chew food on their right side, while left-handed people tend to chew food on their left side. So apparently, if you're left-handed, you're doing more damage or using the teeth on your left side more. Therefore, you could be doing more damage and possibly wearing them down faster. So that's an interesting little tidbit. Okay, so I think it's probably time to get to the doom and gloom part, and we'll save some of the fun dental history facts for later. Okay? All right, let's see here. Oh, and let me just cite my source. This comes from a YouTube contributor known as TWKY. These are the 7 most painful dental conditions ever. Number 7, dental abscess. A dental abscess is an infection inside the tooth or gums that is filled with pus. If not treated properly, it has the potential to turn deadly. While there are a few different types of abscesses, they generally all have similar symptoms. The pain involved with an abscess usually starts off mild, but then can quickly become extremely painful. The pain has been described as a shooting or throbbing sensation. The area in question will also swell up and turn red. In more severe cases, the abscesses may spread to the tissues surrounding the bones and teeth, which could cause swelling in the face and the lymph glands on the neck. The pain will then spread to the side of the face near the toothache. If a severe abscess were to go untreated, it could eventually spread internally to the tissues and muscles near the affected area. This spread could lead to a dangerous condition called Ludwig's angina, or an infection occurring on the floor of the mouth. This disease can be deadly because it often restricts necessary airways. In fact, the name angina is derived from the Greek word ankon, meaning strangling. In addition to feelings of becoming strangled, the face, head, and neck also become infected. It's even possible for people to die from an abscess. Famous fashion designer and notorious Nazi supporter Hugo Boss died from a tooth abscess in 1948. In 2007, a 12-year-old boy in Baltimore named Diamante Driver died from a tooth abscess. When it spread to his brain, despite 2 operations and 6 weeks in the hospital, his life could not be saved. The same thing happened in 2011 to 24-year-old Kyle Willis in Cincinnati, when the infection spread to his brain and caused it to swell. In the cases of both Driver and Willis, the delay in treatment was a result of neither of them having dental insurance. All right, number 6. Periodontal disease. Periodontal disease is the result when gingivitis, when left untreated, begins to deteriorate and attack the bone. It appears as inflammation and infection around the tooth, and when severe enough, can cause tooth loss and damage to the surrounding bone structure. Once your gums are infected, they begin pulling away from the tooth. This space allows bacteria to form underneath the gums. It will then progress by badly damaging the bone structure under the gums, and usually results in teeth falling out or being removed if not treated properly. Symptoms of periodontal disease include sensitive teeth, swollen gums, bleeding gums, loose teeth, and painful chewing. It is often the result of smoking, hormonal changes, or a byproduct of other diseases, such as diabetes or even AIDS. Okay, number 5, edentulosum. Edentulosum is a condition in which a person is either completely or partially toothless. It affects an estimated 158 million people worldwide. As you can imagine, losing one's teeth can be very problematic, as teeth serve many basic yet important functions such as chewing food, maintaining speech, and supporting your facial structure. Teeth also allow humans to break down their food in a manner that is more digestible through a process known as mastication. As a result, malnutrition is a very possible side effect, which may additionally have a domino effect. Weight loss, constipation, and arthritis have been known to occur as well. In the most extreme cases of edentulosum, the condition has even been connected to more serious and sometimes life-threatening diseases such as Parkinson's disease, heart problems, and even cancer. Okay, so far we've had tooth abscess, periodontal disease, and edentulosum. All right, so that was numbers 7, 6, and 5. So now, number 4, TMJ conditions. Temporomandibular joint dysfunction, or TMJ, describes a condition in which 3 important parts of the mouth experience pain: the muscles that move the jaw, the muscles of mastication, and the temporomandibular joints, which connect the mandible to the skull. If left untreated, TMJ conditions can be chronic and quite painful. Symptoms of TMJ include dizziness, loss of hearing, pain or pressure behind the eyes, pain in the jaws or teeth, and headaches including migraines and myofascial pain. The jaw muscles may also become stiff, making it difficult to eat or speak. It's estimated that up to 30% of the adult population is affected by TMJ in some form or another. All right, so we've covered the first 4 of the 7 dental diseases that can be very painful and eventually kill you. And so we're going to save the last 3 till later in the show. But I think what we're going to do now is we're going to get ready to do Dr. Kvitko's question of the day. And let me just refresh our memory, because what I said earlier in the show, one of the fun facts was that children smile about 400 times a day, women smile about 62 times a day, and men smile only 8 times a day. This is all on average, okay? So remember that, because that's going to be Dr. Kvitko's question of the day. And if you didn't already know, it's a contest, so the winner is going to receive a prize. And so you might want to get ready to either send an email or call in. But before we do that question, we would like you to listen to this.
This station will not be held liable for any contesting during The Reasons We Smile with Dr. Kvitko. Participation in the contest allows Dr. Kvitko to record and broadcast your name and call. 1 winner per household. Prizes are non-transferable, cannot be substituted, and are subject to taxes and fees. This station cannot be responsible for the inability to enter the contest, whether due to equipment malfunction or telephone difficulties. All decisions of Dr. Kvitko concerning this contest or eligibility are final.
And now it's time for Dr. Kvitko's question of the day.
All right, we're back. I'm Dr. Kvitko. We're doing Dr. Kvitko's question of the day. And as I mentioned, there's going to be a prize. So the winner is going to receive a free drink from Crimson Cup Coffee on North High Street. And the question is this. As it turns out, men smile a differing amount than women, and women smile a different amount than children. And so the question is, who smiles more? Is it men, A, B, women, or C, children? All right, you don't have to know the number, although we will talk about it when you call or you email. So again, the question of the day is, men, women, and children smile differing amounts on average. Which group smiles more? Is it A, men, B, women, or C, children? All right. The number to call, 614-459-9769. That's 614-459-9769. So go ahead and call now.
Hi, I'm Keith Carlos, winner of America's Next Top Model and star of Chocolate City 2. Look for my smile on the big screen this summer, courtesy of Dr. Kvitko. Stay tuned to The Reasons We Smile with Dr. Kvitko, the world's most interesting dentist.
Hi, I'm Dr. Kvitko, general dentist and host of The Reasons We Smile radio and roadshow. Did you know that you no longer need to visit several different dental professionals to get more complete dental care? We handle everything from cleanings and orthodontics to restoration, implants, and smile makeovers, all in my office. And now we have 2 locations. Get the most advanced technology and procedures available today. It's more complete dentistry.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
Dr. Kvitko, let's go! Hi, I'm Johanna, and I've been a dental patient at Dr. Kvitko and Associates for over 10 years. I would really recommend Dr. Kvitko for your family's dental care. They're friendly. They're always there to help me. I feel like family when I walk in the door. It's clean, it's comfortable. Even if I have to bring my kids, they have a great playroom for them. I know when I'm with Dr. Kvitko, they are taking that extra time to make sure that I'm going to be the healthiest I can be. They've been great. I love them.
Call Dr. Kvitko and Associates today, 614-262-9588.
Hi, my name's Athena. My family and I have been patients of Dr. Kvitko and Associates for over 10 years. We've gone to Dr. Kvitko for numerous reasons, especially cleanings, crowns, and root canals. Since going to Dr. Kvitko, I get compliments every day on how beautiful my smile is, and people always ask me how I get my teeth so white. I used to be afraid of the dentist, but Dr. Kvitko and his staff make you feel very comfortable and relaxed, and I'm not afraid anymore. I would recommend Dr. Kvitko for all your family's dental needs.
Call Dr. Kvitko and Associates today, 614-262-9588.
Hi, this is Richard Simmons. Dr. Kvitko's here, and he's going to help you with all of your problems. Are your teeth yellow? He can fix that. Are you missing a tooth? He can put a new one in. How is that?
That's very good. Thank you, Richard.
All right, we're back, and during the break, my producer took the calls from 4 different people, and so let me just ask my producer, hey, who was the winner of Dr. Kvitko's question of the day, and who had the correct answer, which was C, children. children smile more. Children smile more than both men and women. You might remember that women smile 62 times a day on average, and men smile 8 times on average, and children 400 times on average. So anyway, yeah, who was the winner?
The winner is Meredith. She is in Upper Arlington, and she receives a free drink at Crimson Cup Coffee in Clintonville.
Congratulations to our winner. Thank you so much for listening, first of all, and for calling in. I really appreciate it. I think the question of the day can be a lot of fun, and I did not know that about smiling. So anyway, okay, so now let's go back to some of the doom and gloom. And again, I'm sorry, but hey, this stuff can be serious. And you might remember we're bringing you the 7 most painful dental conditions or diseases, and that can also kill you. Okay, and so at the beginning of the show, we covered numbers 7, 6, 5, and 4. 7 was abscesses. 6 was periodontal disease. 5 was edentulosum. And 4 was TMJ disease. All right, so now we are up to number 3, which is tooth decay. All right, tooth decay goes by many names, but cavities and dental caries are the most common. Regardless of what you call it, tooth decay can have a harmful effect on humans. While they usually cause symptoms such as pain and difficulty chewing, they can also lead to some of the ailments which we've already discussed, such as abscesses, periodontal diseases, and edentulosum. More than 2 billion people worldwide are affected by tooth decay in some form. It is far more common in developing countries where they often lack the resources to treat the problem. Broadly speaking, tooth decay describes any activity that breaks down the teeth. Due to the spread of bacteria, it can be brought on by a number of factors: poor oral hygiene and poverty, as well as other medical conditions such as diabetes mellitus and Sjögren's syndrome. Although diabetes is a result of high blood pressure and Sjögren's is a result of increased white blood cells, both conditions lead to a decrease in the amount of saliva production in the mouth. This is dangerous because saliva works to decrease the acidic activity in the mouth, and it is the acid that actually eats away at the teeth. Thus, a decrease in saliva production leads to bacteria buildup and an increase in the likelihood of developing tooth decay. While bacteria and dietary sugars are also common culprits, they alone are usually not enough to cause it. Exposure to an acidic environment is what significantly increases the likelihood of someone experiencing tooth decay. Symptoms may initially be hard to spot, but as the decay progresses, the affected teeth will become discolored, showing a brownish or a yellowish color. And they may be sensitive to the touch or possibly to sweets or hot and cold. If not treated, the teeth can crumble and allow bacteria to get inside and cause an infection in the gum or down in the tooth, which is actually an abscess, which we talked about earlier in the show. This has the potential to cause a blood clot in the brain and lead to Ludwig's angina, which, as we've already mentioned, can be life-threatening. All right, so now we're down to number 2, burning mouth syndrome, also known as BMS. Burning mouth syndrome describes a situation where there is tingling or a burning sensation in the mouth without an apparent cause. While medical experts aren't exactly sure what causes it, there are several different theories. One is that it is related to menopause, because many of those suffering with BMS are postmenopausal women. Others believe that it may be an autoimmune disease, but there doesn't seem to be statistical correlations to back either theory. Some hypothesize that it is the result of a psychiatric condition because there seems to be a connection between BMS and anxiety. Okay, and that leads us to the number 1 dental condition, potentially painful dental condition, that can kill you. Here it is. Oral cancer. Oral cancer describes any cancerous tissue within the mouth. The vast majority of oral cancers are classified as squamous cell carcinomas, a type of cancer that originates in the mouth tissue but can spread to the digestive tract and lungs. In 2013, over 130,000 people died from oral cancer in the United States alone. Most cases of oral cancer are due to human behavior, such as tobacco use, poor nutrition, poor oral hygiene, and poorly fitted dentures. The most common symptoms include pale colored ulcers, as well as lumps on the mouth, on the tongue, inside the mouth, or behind the teeth. These ulcers are not very painful at first, but they do become more painful as the cancer progresses. A person afflicted with oral cancer will have trouble swallowing and moving their tongue. They will also develop painful mouth sores and a sensation known as paresthesia, which is a tickling or tingling feeling inside the mouth or face. As a side note, oral cancer is the most common form of cancer in India, with about 130,000 people being diagnosed each and every year. Its prevalence stems from the high rate of tobacco use, including snuff, quid, hookah, and smear. In the U.S., approximately 35,000 cases of oral cancer are diagnosed each year, and about a third of those people will die. All right, so there you have it. That is the doom and gloom portion of the show. We've now completed all 7 of the dental diseases that can be very painful and can even kill you. And so I think what we're going to do is we're going to go to a break right now, and when we come back from the break, we're going to talk about some fun dental history facts. Fun facts about dental history. Okay? All right, we'll be right back.
This is Clark Kellogg. Stay tuned for more of Dr. Kvitko.
Estás escuchando con Dr. Kvitko aquí en su estación favorita.
Hi, I'm Dominique Reichert. Like what you hear? Why not use the show to promote your product or service by becoming a sponsor? Call 614-262-9588 to learn how. That's 614-262-9588. Call now.
Hi, I'm Dr. Kvitko, general dentist and host of the Reasons We Smile radio and roadshow. I've been honored to help several famous people get a perfect smile, like Keith Carlos and Dominique Reigard from America's Next Top Model, and Ted the Golden Voice Williams from right here in Columbus. Isn't it time you had a celebrity smile? It costs less than you might think, and most of the time, it can be done in one visit. A new smile can make a world of difference.
Visit worldsmostinterestingdentist.com for more info about Dr. Kvitko.
I'm Grandpa, and I go to Dr. Kvitko, and I still have all my teeth. Real ones. Where's my glasses?
If you're just joining us, I'm Dr. Kvitko. This is The Reasons We Smile, episode number 447. Let me remind you that all episodes of the show are available at thereasonswesmile.com. Okay? So now remember, we were going to do some fun dental history facts, and this one is about dental products and their origins. So toothbrush, and this is kind of poignant since we just got through speaking about India. So the first people to use a toothbrush were the Hindus of India, who used the end of a fresh twig, which was frayed into fibers, in 4000 BC. The Babylonians in 3500 BC called their toothbrush a chewing stick. A toothbrush made of hog bristles was used in China in 1600. In 1780, William Addis of England invented a brush used to clean teeth. The handle was made from cattle bone, and the bristles were from swine. The first toothbrush, as we know it today, was invented in 1857 by an American named H.N. Wadsworth, followed by a patented 3-row toothbrush of serrated bristles with larger tufts created by Dr. Meyer Rhine. The next phase of toothbrushes replaced the swine bristles with synthetic bristles. It wasn't until 1938 that nylon brushes with plastic handles were invented. The nylon bristles were less abrasive to the teeth and gums. Daily toothbrushing habits were not talked about as a public health issue until the end of World War II, which kind of surprises me that it was so recent. Most toothbrushes today have more than 25,000 bristles and 40 groups of tufts. Of course, the electric toothbrush is now another alternative, which was produced in the United States in 1960, and of course, most recently is the sonic brushes and the water pick, and we have all kinds of adjuncts now, things like the flossers and all that. Anyway, pretty cool. Okay, let's talk about toothpaste for a minute. Dental toothpaste has been used since 5000 BC in China and India. In 1824, a dentist named Dr. Peabody actually added soap to toothpaste. Many compounds were added to toothpaste like chalk and flavors during the 1850s. In 1892, Dr. Washington Sheffield created the collapsible tube dispenser. After World War II, other agents were used, ultimately resulting in the addition of fluoride. So that's it about toothpaste, a little bit of a history there. How about dental floss? Dental floss-like substances have been found in the teeth of early pre-humans and American Indians. Dental floss, made from a thin thread of silk, was first invented in 1815 by a New Orleans dentist named Levi Spear Parmley. Floss was not manufactured using unwaxed silk floss until 1882 by the Codman and Shirtlift Company in Randolph, Massachusetts. In 1896, Johnson & Johnson Company released dental floss made from silk surgical sutures. After World War II, a medical doctor named Dr. Charles Bass thought that nylon had advantages over silk floss, which was prone to shredding. Nylon had a greater resistance, could be produced in bigger quantities, and could have diameters that are consistent. Dental floss remains a critical component for good oral health today. Okay, how about this? And again, this is from Smile Discoveries from Delta Dental of Minnesota. Ancient beliefs about what causes tooth decay. There are several ancient theories about the cause of tooth decay. Queen Elizabeth I was known to have discolored teeth. Paul Henter, a German traveler, believed that her discoloration might have been caused from the excessive consumption of sugar. Before 1960, Americans believed that a toothworm, which either had appeared spontaneously or had bored its way into the tooth, caused the stabbing pain of a toothache. If the tooth pain was severe, it meant that the worm was thrashing around, but if the aching stopped, then the worm was at rest. Now, you know what that equates to is you get this terrible pain when you have decay that affects the nerve, and then what people tell me is, well, then it kind of goes away. And what we're really dealing with there is, in some cases, the nerve actually dies, and so people think everything's fine. And it's not really fine, it's just that it died, so now it can't hurt anymore. But what happens is, given a little bit of time, you will get severe pain because you get this abscess building up, and the pressure from that hurts like crazy. Okay, so let's see. Cultures all over the world held on to the notion of the toothworm, even though many of the cultures had no contact with each other. The folklore of the toothworm persisted from ancient times to the beginning of the 18th century, and it wasn't until 1960 that Dr. Paul Keyes discovered that tooth decay was actually caused primarily by bacteria known as Streptococcus mutans. And honestly, today we think it's not only Strep mutans that causes decay, but we think it's Lactobacillus. Okay, well, that's probably all the time we have to go over these fun dental history facts. Just want to say that on Saturday, July 30th, I was at the Living Smart workshop at the New Birth Christian Ministries doing free exams and free oral cancer screenings. And I interviewed some of the people there, and we're going to bring you those interviews next week. So we're going to learn about what people are thinking about their dental care, and the kind of conditions they see, and what did we learn at the event. It was a really great event, actually, and we were happy to have to be participating. So yeah, next week we're going to learn more about that. Okay, so like I said, we are running out of time. I would like to remind you to, if you would like to follow me on Twitter, it's at Dr. Kvitko. And if you would go to my office Facebook page and like us, that would be awesome. Very much so. And every episode of this show that we've ever done, all 447 of them, are available at thereasonswesmile.com. Oh, and don't forget, there is a video to go with each one. All right? Yeah, we videotape each show. So if you want to put a face to the voice, you can do that. And you can also see my guests when I have guests live in the studio. All right? So be sure to tune in next week and every week right here on your favorite station. Goodbye.
This is Carly Red from Love and Hip Hop Atlanta, the hit show on VH1, urging you to tune in next week with my dentist, Dr. Kvitko.
If you're interested in learning more about this and other dental health topics, go to thereasonswesmile.com to access full episodes of Dr. Kvitko's show.
If you'd like Dr. Kvitko, the world's most interesting dentist, to speak at your next event, please call 614-262-9588. That's 614-262-9588, or send an email to speaking@thereasonswesmile.com.